Welcome to maternity services here at Royal Darwin Hospital. We are looking forward to getting to know you and your growing family. Right now, you might be planning to have your baby at Royal Darwin Hospital. This video will show you the places and faces you might see while you're here and explain what will happen when the time comes for you to birth your baby. Your Aboriginal Health Service can help you book somewhere near the hospital when your baby is almost due. The patient travel or PATS bus can pick you up from where you're staying and take you to and from your checkup and scan appointments. The Aboriginal liaison officers are based on the ground floor of the hospital and can come see you in other areas of the hospital too. They can help you if you have any worries or need to ask some questions about your time here. They can help you find your way around the hospital, give you advice on Centrelink, travel, and accommodation if you have to stay in town longer than expected. The antenatal clinic unit is where you might need to go for your checkup appointments and scans before you have your baby. To get there, go to the 8th floor of the hospital. When you get to the 8th floor, go to the clinic window and then let the staff member know who you are and that you have a checkup appointment. They'll let you know where to go next. There are colored paw prints that you can follow to get to the right place. The waiting room can be busy, so listen carefully for your name to be called. The birth center is located on the ground floor of the hospital. You might come here for classes to learn about pregnancy and giving birth or to attend the checkup clinic. You can enter from the door on the ground floor near the main entrance and the cafe. When it's time for you to have your baby, you'll need to come to the delivery room on Ward 6B. One thing that people usually want to know is when is the right time to come to the hospital. Call us at any time. We'll have a chat with you and we can decide together when you should come to hospital. To get to the delivery room, take the elevator to the 6th floor. Turn right out of the elevator and push the silver button to talk to someone through the intercom and get buzzed in. The door isn't automatic, so pull the handle to open it. We'll be there to welcome you when you arrive. Midwives care for you during pregnancy, labor, and in the first few weeks after you give birth. When you arrive, we'll talk to you about what's happened so far and have a feel of your stomach to see what position your baby is in. We'll listen to your baby's heart rate and check how far apart your contractions are. This can give us a lot of information about what stage of labor you're in. After that, we can make a plan with you for where the best place is for you to continue your labor. Either here on the 6th floor, downstairs in the birth center, or maybe even at home or where you're staying, depending on what stage of labor you're in. This is one of the labor rooms. All our rooms have all the equipment we need to support you and your baby if needed. You'll have a team of doctors and midwives to help you during labor and birth. We can set it up the way you like it so that you have everything you need to feel comfortable. If you're not sure what you should bring to the hospital, you can ask your midwife for advice. If you have no complications or problem in pregnancy or labor, the birth center on the ground floor of the hospital may be an option for you. The birth center rooms are bigger than the rooms upstairs and each have access to an outdoor area and a large bath. If you think you would like to birth at the birth center, speak to your midwife at your next appointment. We can't guarantee the birth center for everyone as we need to be able to take the best possible care for you, especially if you already have other health concerns that might mean you need to give birth in the 6B labor ward. No matter where in the hospital you are, once labor begins, doctors and midwives will be with you every step of the way. After the birth, you and your baby may stay in the 6A maternity ward for a few days to recover. We are all here 24 hours a day to help with any of your worries, so please let us know if you need anything. Visitor hours can vary depending on the COVID situation at the time. Make sure you check with your midwife, nurse, or Aboriginal liaison information officer to find out more. If your baby is born early or unwell, they may stay in the special care nursery where they can recover extra care. If your baby needs to come here, we will show you around. After you leave hospital, we can visit you at your home or accommodation for up to 10 days after your baby is born. We're here to support you with feeding your baby and answering all your questions as you learn to care for your newborn baby. When you and your baby are returned to community, patient travel or PATS will organize your travel home. They will let you know what day and time you will go home. If you are flying home, there might be rules about how many bags you can take on the plane. The patient travel or PETS bus can pick you up from where you're staying and can take you to the bus or the plane. If you have questions, talk to your midwife, doctor, Aboriginal liaison officer or Aboriginal health practitioner.